Welcome to the Thursday Talk with a coder and a clinician. Today I am joined by Sonia Garza. Sonia has been in the revenue cycle business for 15 plus years. Through her tenure, she has performed a series of roles, starting her career out as a medical assistant. She quickly realized the importance of the revenue cycle and its processes. She has held positions as a collector, a biller, revenue cycle analytics specialist, and a revenue cycle director or manager. She enjoys spending time with her family when she is not knee deep in policy and regulations. So, Sonia, thank you for joining us today. We are going to be talking about the importance of maintaining a healthy revenue cycle. And I know this is something that you know a lot about. Since the pandemic began, many of the groups out there have struggled with maintaining a healthy revenue cycle. And so before we get started, I just want to go over what is a healthy revenue cycle and why are so many groups struggling with this seemingly easy process. What's interesting is a recent HFMA article states that the healthcare revenue cycle is the lifeblood of any hospital or health system. It compromises all the activities that lead to payment for services provided, from patient registration to verification of benefits to care delivery, claim submission, and reimbursement. It also requires organizations and communication on multiple levels for success. So an efficient and effective revenue cycle management is key to your survival. It directly impacts the group's ability to contribute to health and well-being of its community. Did you know that the most common challenges for groups boil down to 4 basic things? The first one is billing and collection errors, lack of technology, untrained staff, or absence of financial policies and metrics. So with those things in mind, Sonia, I'd like to kind of ask you a couple of questions because you are currently working in revenue cycle and you're seeing a lot of the things that have happened since the pandemic started. So I'm hoping that you can give us some insight as to what exactly is going on. So the first question I have for you is, what do you think is contributing to groups carrying a higher than normal AR balance today?
I'm going to say probably ever since the pandemic, probably the lack of expertise. We've had staffing issues pretty much, anywhere you go, any health system that you go to, you're going to have some staffing issues. So with that comes, people who don't understand fully how to do everything from beginning to end. So, if a claim denies, they come to a crossroads. Well, what do I do? I've never experienced this before, because they're really, a lot of businesses are hiring people pretty much off the street because they need somebody to fill that seat. So it is a lack of expertise, along with the staffing issues. And even with those who don't have any staffing issues or haven't, had to see any of those problems, not staying up to date with payer updates. So, everything happens usually at the new fiscal year. So you really need to make sure that you're part of your payers' newsletters and see what new rules have they passed. A lot of insurances follow suit with Medicare. So if Medicare comes out with a new rule, eventually the other payers will start to follow suit. So just really keeping up with what's going on. Go to conferences, do whatever you can, listen to podcasts, try to understand what's happening. But those are probably one of the biggest things that I'm seeing, is because, like I said, people were just so willing to put somebody in that seat to fill it. They, maybe weren't trained properly, or they didn't have the background to take care of these denials.
So you mentioned staffing challenges. What has led to all of these staffing challenges that people are facing across the revenue cycle industry?
Well, some companies or, healthcare systems, they aren't ready to move to the new age of things. So a lot of, places are now remote. A lot of job positions are remote, and some healthcare systems, they kind of want to stay old fashioned. They want everybody, in house, which is great, if it works for you. But, a lot of people are willing to go to other jobs that are doing remote, work there. It's easier for people. People seem to enjoy it a lot better to work from home. There's an increase of work for a lot of companies because their employees are now happy working from home. They save money by working from home, not having to travel, not having to take tolls, not having to put gas in their car, not having to pay for lunch. So, they're seeing, a rise in their money per se, because they're not spending as much as they are going, on site. So a lot of companies really need to, weigh the pros and cons whenever they're deciding. Like I said, I understand that, some companies want to see faces. They actually want to see their team, which is fine. But, there's ways around that we, currently do for ours. We make sure that we have weekly meetings with our team, and they're face-to-face, cameras on. Everybody has to see each other. Staying, really close with your team still. It doesn't mean that you have to see them face-to-face. You still can remote-wise. But you really need to pretty much, like I said, kind of move with the times. This is the way things are now. And really at least consider, having your team work from home.
Yeah, the pandemic really made it so a lot of people enjoy working from home. They feel like they're more productive. They get that extra hour of commute time where they're actually able to work.
Yes, absolutely.
So with the revenue cycle process, there's a lot of talk about that initial registration and how that initial registration can cause all sorts of issues down the road. Mm-hmm. What have you seen around the registration process that has created some revenue cycle challenges on the back end?
So it all begins in registration. It really does. And it can have this trickle down effect. If registration isn't getting correct and updated information, then we're going to see it on the back end. So if we have an outdated subscriber ID, or if the patient doesn't even have that insurance anymore, that's going to cause an issue down the line. We're going to get the rejection or denial from the insurance saying, hey, this member is no longer covered under us. So that's more days. You have to wait to get paid, because now you have to reach out to the patient and get the correct information. And then once you change it in the system, then you have to send it out, and then you have to wait for that insurance to process. So registration definitely needs to make sure that they're doing their due diligence. I can understand that sometimes you care so much for the patient that you're really just listening to them. Or because, some people come to registration, some patients come to registration, they kind of they want to tell you their life story. And that's great that you can be the face of the company, because you really are the face of the company. You're the first person and usually the last person that the patient sees. So you definitely want to have that, I guess that one-on-one, if you will, with the patient. But you also have to remember that, hey, what you're putting into the system could affect, down the road. It's the trickle down effect, and it can affect your AR because you aren't getting the correct information, or you're putting it in wrong just completely. So, which is another reason that your back end team definitely needs to make sure they're communing with the front end.
So are there times of the year where you tend to see more registration issues and problems than other times of the year?
Probably during the summer is probably going to be one of the big ones, because that's whenever, patients, they're out of school. If they're kids, they're out of school. Parents, maybe that's whenever they want to schedule any surgeries or anything that they're having. Same thing for the kids. So you're definitely going to see an influx of more patients. So the more volume, probably the more registration errors you're going to have. So, you probably see less of it at the beginning of the year, only because, deductibles reset. So not too many patients are going into the doctor or having their surgeries done. That's another thing that you need to keep an eye on, is when your high points are and when your low points are for patient volume. So that way you can kind of prepare, and you can kind of tell your team, hey, this is the time that we start seeing more patients. So you need to keep your eye on what you're doing, and, be really careful when you're putting in information in the system.
So talking about systems, can a billing system be a contributing factor to poor collections for your group?
Absolutely. Definitely. Your billing system should work for you, not the other way around. So it should be able to streamline your processes that you have for your team. It should be able to pull accurate reports. It should be able to do everything that you need in order to run your revenue cycle. If it can't do any of the basic, duties, then you really need to start shopping around for another billing system. Your billing system shouldn't make your work harder for you. It needs to make it a lot easier. Also, you need to understand what your billing system can do. Some people have so many, applications with their billing system that they're not even aware of. So be sure that you know everything that your billing system can do. That way it can help you and your team down the road.
Yeah, it's not necessarily buying the cheapest billing system or the most expensive billing system. It's more finding the one that functions best for you.
Absolutely.
So on that note, what do you think groups should do to make sure that their billing software is functioning at the highest capacity for them?
Quarterly audits for your billing system. Definitely. You need to make sure that you're tracking any variances and trends that you're seeing in any of your payments. If you're starting to see that, one of your payers like Cigna is, not paying this CPT but you haven't expected in your system, you need to go in there and say, I need to update the system because we shouldn't have an expected for that CPT. It's not even covered under that payer. So keeping track of all of your variances and trends, that's going to be a big one. Make sure that your IT team is also doing system updates whenever they're available for your billing system. That's probably a huge one.
And I think it's really important that groups that are going into a new billing system, that they get the right people in place to make sure that every functionality or every programming piece needs to be done to that highest level, that you have the right CPT codes in place, you have the right fee schedules lined up, you've got your NDC codes all ready to go. Just because if you miss any of those key portions, your claim ultimately cannot even go past the clearinghouse level.
Very true. Yes, very true.
So on this same note, do you really feel it's important to have qualified people working your AR and your claims and in your billing systems to see success?
That's a yes and no answer. You always want to have people who have a background in doing what you're doing. That way, you don't have to spend too much time training. You basically are just training them on your system and how your company does things. The other thing is, if you pull somebody who doesn't really have too much of a background in it, as long as you have qualified trainers and have, procedures and processes in place that are easy to follow, and you bring somebody on who's willing to, take on that role, then you really can set up a team for success. So I've seen the pros and cons about hiring somebody who's had 20 years experience and been doing it, for, half of their life. And, that's great. But sometimes I've brought people onto the team that had zero experience, and they ended up being better and more qualified than those who've been doing it for 20 years. So you really need to make sure you have, a qualified trainer in place if you're going to hire somebody who doesn't have any experience doing what you're doing.
So you actually mentioned policies and procedures, and why those policies and procedures are so important to making sure that revenue cycle stays on track. With policy and procedures, is it important to have those already identified and lined up before you start the AR process?
Yes, definitely. You're always going to come across situations that you've never been into before. And then that's kind of where you can, cross that bridge when you get to it. But you need policies and procedures that the team can, they have guidance on what to do next. Especially if you want everybody on the same page. You don't want, if you have a team of 20 people, you don't want 20 different ways to do it and everybody, isn't on the same page, because you might come up with different results. So you really need to make sure that everybody's on the same page. Hey, this is what we do in this situation. And like I said, you can't plan for everything, but you definitely need to make sure that everybody knows, or at least who to go to if they ever come to a situation they've never come across.
Yeah, that's really important, that there's key identifiers as to when you come across this scenario, this is how you handle it. For all the years that you've worked in revenue cycle, are there any metrics that you feel are better for a group to start tracking so they can really assess and see where they're at with their revenue?
So your billing system really should be identifying AR days, and that's a good place to start. You really want to see, with AR days, you really can't see a lot with just looking at that. From, there's quite a lot of reports that you can run just, where your AR days is pulling from in your system. So if you've got low AR days, I mean, that's great. That's wonderful. But if you start to see it start to go up, then hey, let me look at my aging. What's going on there? Am I not getting as reimbursed as high as I should be, or as how much I'm expecting to be? So, really looking at the AR days, that's probably going to be your place to start of, what you need to do and what you need to do for the day as far as what you need to focus on.
Do you think it's important for groups to know when payments are supposed to come in? I know when I was working as a revenue cycle director, I had my team track when, United Healthcare paid, Cigna paid, Blue Cross Blue Shield paid, just because, back then we were dealing with multiple methods of payments. We were looking at virtual credit cards. We were looking at ACHs. We were looking at paper checks, and we needed to be able to kind of track when we were expecting money to come in the door just to kind of manage our cash flow. Is that something that groups still have to worry about today?
Yes, definitely. I mean, you pretty much got an idea. So if those who have been in, this field for quite a while, Blue Cross Blue Shield is probably one of the quickest payers. So that as long as you've got a clean claim, Blue Cross Blue Shield, they're going to be quick to pay out their claims. But you do want to know, kind of keep track of what your payers are paying and, how long out that they pay. There's some payers that are required that they have to process and pay the claim within 30 days. So, you can keep track of that. If you start to see that your payer is starting to get behind, then that's a variance right there. That's a trend. You need to see what's going on there. Is there something that you're doing wrong whenever you're sending out the claim that's causing that payer to not pay you as quickly as you thought that they would pay you? So those are all, one of the biggest things that I do all day is check for variances and trends. And that's how I'm able to keep a good handle on our AR.
We've talked so much about the insurance company's responsibility with the healthcare revenue cycle. Does the patient have responsibility when it comes to making sure that the revenue cycle is effective?
Absolutely. They need to make sure that they have their, insurance is completely updated and they're giving you accurate information. They need to work with the revenue cycle. They need to be able, if we give them a call and say, hey, this, and you have two insurances and this one's saying they're primary, but this one's saying they're primary and they don't even know about that you have secondary insurance. So you need to, communicate with the patient that they need to update their COB. If insurance is requiring accident details, that's something the patient needs to do because it's usually a form that the payer has and they'll send it to the patient. Usually, they'll mail it to them, say, hey, fill this out and we'll pay your claim. So, I mean, the patient is really just as responsible as revenue cycle to make sure their claim gets paid because they need to be able to work with revenue cycle in case there is any missing information in order to get that claim paid.
I know a lot of groups, especially in the emergency medicine realm, are non-par with insurance carriers. And because they're non-par, there's no legal responsibility for them to have to submit those claims for the patient. They actually do it as a courtesy to those patients. And I think sometimes that gets kind of lost in the shuffle where people automatically assume, well, hey, I saw you took care of me. I gave you my insurance information. It's now your responsibility. And there's a big disconnect that even though you gave the financial information or you gave whatever information you had, you're ultimately the one who's still responsible for that healthcare bill.
Yes, absolutely. I mean, that's another reason that providers out there, they need to make sure that they're maintaining a good relationship with their patients, because as soon as they leave those doors, your chances of getting a hold of that patient go down. So while they're there in front of you, you need to make sure, double check the information, with that patient. Say, hey, is all this information correct? Has anything changed? Do you still live at this address? You need to make sure you have the most updated information from your patient, and also maintain a good relationship with that patient. If you aren't very, if you don't have the best bedside manner, or you don't have the best people skills, with your patients, they're not going to be very apt to help you.
It's interesting that you say that. Working in this industry for long periods of time, I know I've taken phone calls, you've taken phone calls where angry patients call us and say, I never knew this is how much my physician service bill was going to be.
Mm-hmm.
A lot of states are now required, and I think it might actually be on a federal level as well, to make sure that you post your prices or you educate your patients as to what their medical bill is going to be as part of the No Surprise Act.
Mm-hmm.
Are you finding any challenges in the revenue cycle arena, making sure that patients are aware of how much their bills are going to cost?
If anything, it's gotten a little bit easier because now patients are actually getting online. Now that they know about the price transparency, they're getting online, before they go to that provider. And some of them are doing their research before they're even seen. And so they know, what to expect whenever they go in there. I think that issue has actually, or that problem has actually gone down since, the price transparency came out. Because, people want to know, what they're going to have to spend their money on or how much they're going to have to pay once their insurance is processed. So I think that's actually probably gotten a little bit better.
Yeah. As we look at the big picture of healthcare revenue cycle, and we look at some of the challenges that groups are facing now with higher balances that they're carrying on their age to AR, when should groups realistically start to follow up on claims where they haven't received a payment?
I'm going to say probably after 30 days. Really, I mean, that's when you should probably be taking a look at those claims and seeing what's going on. I know I've been a part of organizations, well, they'll wait 45 days to see what's going on. But if you really want to get, ahead of everything, I would start just taking a peek at like 30 days, see what's going on. Payers, they, especially the lower claims, they do want to hurry up and pay those and get them out the door, get them off the books. But it's been like this across, as long as I've been in revenue cycle, where for the higher dollar claims, they're going to be requesting medical records or they're going to be requesting something else. So that's pretty much, that hasn't changed, where they are going to take a little while to get you paid. But I would just, 30 days is a good marker, I believe, to start looking at these claims.
So when you get to 90 days, it's almost kind of too late, right?
Yes, because, some of these payers, they're like past timely to, send in your appeals. That's why you have to stay up on these claims. I mean, I think having to adjust a claim to timely, whether it's, you didn't bill it out timely or you missed appeal deadline, that's probably one of the worst adjustments that I hate doing, is because we had the chance to send it timely and we just didn't. So that's just completely on us when we have to do something like that. It's such a simple fix to make sure that you're sending out everything timely. And it helps your ARs if you're staying up on these as well. And, if the higher dollar claims, you already know that, especially Blue Cross Blue Shield, if you ever bill out a level 4 or level 5, they're going to want medical records. So that's something you can actually program in your system, depending on which one you have, that if you have a level 4 or 5, you can do a charge router and send it to a work queue for someone to send out medical records along with that claim. And it'll, get the claim processed a lot faster than if you wait for them to say, hey, we need medical records before we, approve or deny this. But yeah, you need to make sure you're staying on top of those timely filing ones.
Yeah, I think that's one of the biggest challenges. There's so many people that, first and foremost, don't pay attention to that patient registration process because they don't realize that that's actually part of revenue cycle. But then the other piece is I think they forget that you can't just keep rebilling claims. If you don't
Right.
get a payment, you just can't keep rebilling, because then the insurance carrier gets it and they will start to deny it for duplicate.
Mm-hmm.
When And then when you get duplicate, it doesn't necessarily mean that you've been paid for any of them. It just means that they've received it multiple times in house. And so instead of just hitting the rebill button, you really do need to have an AR staff that is competent enough to get on the portals, figure out what's going on, to make the phone calls to the insurance carriers to find out, hey, why did this not happen? And then I think the other piece that groups tend to forget, and you might agree or disagree with me, is the clearinghouse edits. If your
Mm-hmm.
claim doesn't actually pass through the clearinghouse and you're not checking those edits every day, you're not going to know what is being pushed through to the insurance carrier and what is something that you have to fix internally.
Yes, definitely. And that's, where your revenue integrity folks come in. They need to make sure that they're checking those edits and getting them and how to, fix them. If they get a rejection, they need to know how to fix that claim to get it out the door. Because then if you have no idea what to do and nobody knows how to fix it, then it just sits there and now you've got a timely issue. But yes, with the rebill, it can also raise some flags. And you definitely don't want to, have your payer audit you because you've got, 500 rebill claims that, they've denied for duplicates.
Yeah. So in closing, Sonia, do you have any final thoughts to share with the listeners on what you need to do to maintain that healthy revenue cycle in today's world?
Once again, staying up with your payer updates and your changes. Always look for trends in your AR. Don't be afraid to run a couple reports, even if you come up with the same answer. Just try to, look for different things. Identify the strengths in your team. If someone has a lot of experience working with Aetna, Blue Cross Blue Shield, have them work those high dollar claims. If you have an appeals specialist, that's great. Get them in there and help the other team if they're not very comfortable doing appeals. Cross training. You want your team to. You kind of want people to have a little bit of everything. When it comes to revenue cycle, just have a little knowledge so they can jump in and assist anywhere they're needed. For anybody in management, probably one of the biggest bits of advice I can tell you, because I'm guilty of it as well, is don't try to do everything yourself. Delegate to your team. Like I said, use your teammates. They can help you. They can get you out of that rut if you feel that you're drowning. I'm one of those that, let me just do it myself because I feel like, I can do it the way it needs to, but but I've learned to, let the reins go a little bit and, use my team. That's what they're there for. We're all on the same team, which we've got the common goal, to get it done. So that's probably want to be my biggest advice is don't take everything on yourself.
Yeah, absolutely. Well, thank you so much for joining us today and sharing your thoughts around healthcare revenue cycle. We greatly appreciate your time.
Thanks for having me.
Thank you, everyone, for listening. We hope you can join us for the next Thursday talk.